the question, Wendy. I'll be really quick. I'll read straight from our script. Really, the Greens have a plan to create world-class public health services, build a Medicare of the future, guarantee free or low-cost access to all essential community services such as disability service, childcare, mental health, aged care services, and the more did include natural therapies. So I'm pretty much sure it's a yes. I can't give you 100% yes, but that's as close as yes that I can give. Also, free dental care is part of our policy. So thanks for the question. Personally, yes.
Yeah, I've got a bad back myself, and I've had acupuncture many times, and it's helped me. And I definitely think it should be back on the healthcare fund for sure, especially if for long-term sufferers as well. I mean, for things like that, for like cancer patients and stuff like that, for suffering, when the medicines stop working, they can look for other remedies like that to ease the pain. So I definitely think it should be something that should be put back on. Thanks.
I think it's crazy that they're not supporting it. In principle, absolutely. I think it's a great idea and a great concept. In fact, wouldn't it alleviate some of the pressure on our current medical system if they let people come to you? Like, hello, it's not rocket science. Yeah, absolutely.
Can't give you a specific response to that one because I need a little bit more time to research, and as I said, I don't throw things out there that I don't have full information on. But look, we are going to look at the Medicare freeze in terms of how that works, whether or not it impacts on that. But the real question is, when you take $58 billion out of a health system in 2014, that's the real question. What does that mean? It means we don't pull down hospitals, we get rid of people and we get rid of services, and we're still crawling back. That's the problem. That happened in TAFE, it happened in health, it happened in education. I was a principal of school and I saw what happened in terms of the resourcing way back. So we're actually still crawling back those huge cuts that were brought in. But in terms of our funding, we're putting significant funds back into the health system to try and lift the services. And I suspect that something, as you have mentioned, will get caught up in that. We are still recovering from the huge cutbacks. That's the problem. And that needs to be addressed. And our people need to be getting the best service possible, not just our doctors and nurses, but our ancillary, those people who do other things in the health industry. And I'm lucky. I still am. I'm in the Teachers Health Fund, best one in the country. And we got support for that, not now, but we did get support for that. So yes, it is an important question, and we need to look at all elements of health for our nation and bring all people through. And it doesn't matter where they live and what they get. The services they get should not be determined by their credit card